About Elmhurst Hospital in particular, because it was the epicenter of the corona crisis last month, and the first wave of death claimed more than a dozen lives in just one day. This morning we are checking in with Dr. Eric Way from Elmhurst Hospital, who can give us an update on how things are right now. Doctor, thank you for joining us. So as we look at the numbers and the decline here, how many coronavirus patients are you currently treating at Elmhurst?
So we're still extremely busy here at Elmhurst Hospital. We are past the peak and the plateau, but given the length of time that critically ill COVID patients remain on the ventilator, our ICUs are still full. We're still seeing many more patients than normal, but all the metrics are trending in the right direction. And I think that's a huge tribute to what the mayor and the governor have done around social distancing, and New Yorkers doing their part in social distancing.
Well, let me ask you this. At the peak, help us understand what was happening inside Elmhurst, because many patients were being treated there. There were so many stories of folks not only being on ventilators, searching for ventilators, but even staff needing help as well because they were getting sick. Give us an indication of how many people you treated and how dire was the situation.
Yeah. No, I think this is something that we've never seen before. None of us who have worked in healthcare, worked in Elmhurst and health and hospitals. But what I saw working as an emergency medicine physician was heroism. It was like a orchestra of everybody doing their part to save lives while drinking out of a fire hose in terms of the number of new COVID patients coming in to the emergency department, requiring immediate resuscitation, being put on a ventilator, and being brought upstairs to our ICUs. Our staff just so proud of what everybody did. I think a good analogy is in the kind of battle scene of a movie where everything goes into slow motion and you're kind of panning across, and everybody's doing their amazing part as part of what felt like an orchestra in chaos.
I can't even imagine how surreal that had to have been for those like you, healthcare workers on the front line. Give me an idea of what it was like for them in the sense of, because I understand those on the front line were getting sick as well. So how are you balancing treating people, trying to stay healthy, and then making sure that you don't go home and give it to your family?
Yeah, no, absolutely. Healthcare workers are humans as well. We have the same anxieties, the same fears about our own health, about contracting COVID-19, about our children, about our loved ones, our parents. But the truth is, we run towards fire. We run towards the emergency departments where we know there's a high concentration of COVID. We run towards the ICUs where we know there are COVID patients, because this is what we signed up for. This is our mission. We know we're the last and only line of defense to save lives, to save New Yorkers. And having the personal protective equipment to protect us from COVID, I think it made all the difference.
Right.
And I think we'll see that our numbers of employees who contracted COVID is actually much lower than...
At its height, though, let me ask you, how many employees contracted it?
I don't have those numbers in front of me right now. Our hearts go out to everyone who did contract it. We're treating many of our own. But the truth is, right, you can never know for sure where you got it. We think, many of our employees, most of our employees live in this community, living in New York City, right? We're learning that up to 25% of people are testing positive for antibodies. And so, riding the subway, going to the store, going to restaurants before we knew that it was being transmitted in the community at the rates it was. But yeah, I think feel much safer being in an N95 mask with a face shield than riding the subway not knowing.
Yeah, there's a lot of components to this. We appreciate your time and kind of giving us a glimpse inside the epicenter, if you will, because Elmhurst was just really key to the frontline work there. So thank you to you and all your colleagues who risked their lives trying to save lives. We appreciate your time today.
Yeah, thank you for having me.
Absolutely. Okay.